How many of you have heard the phrase from your practices that we need to see more patients? Are you guys hearing a lot of that phrase throughout your healthcare journey? We need to see more patients. Well, I have, and I remember being so busy in those times that adding new patients seemed crazy, seemed out of there. We couldn't even get all the patients that we were calling in. We had a 6-month wait list. So sometimes it's not just about seeing more patients. Sometimes there's other challenges with growth that need to be addressed. So let's start by discussing some of the most common challenges that medical practices face in their growth journey. Unfortunately, I'm going to go ahead and throw those up there. These these are very common amongst practices, and sometimes some of these are on a daily basis. So addressing these challenges takes strategic planning. It takes an investment from the team. We talk about these in all of our trainings. Everyone wants to be on the same page, especially related to growth. So take a look at some of these. Can you point to one of these areas in your practice that you recognize as a challenge for your own growth in your practice? Can anyone share some of those challenges, those common challenges to growth that you're experiencing? Poor Wendy's been out for a while. That might be a big challenge for her, trying to get back into the swing of things. But overall, all of these things are going to contribute somehow. Staffing shortages. Do you have enough staff to handle growth, to handle the patient volume that you're trying to achieve? Do you have enough space, or are you going to be busting at the seams if you add more people? Is it already a burden to fit patients into exam rooms? So these things have to be considered. One of the biggest challenges on here is reputation management. What are your patients saying about you out in the community? These are all extremely important and common challenges that should be addressed. So sometimes you don't get to choose the patients that come in. You have maybe a heavy capitated practice, or you have a lot of HMO patients, but if growth is your goal, you can absolutely further define within these groups. So maybe your target is to become the leader in women's health, or you want to focus your efforts on vaccinating all the kids in your school district. These are things that can be accomplished by doing some analysis of the market. So defining who your target market is. Who are your patients? They call it low-hanging fruit. Who are the patients that are already in your pipeline? Can you enhance those areas? You really want to be looking at all of the patients that you currently see. What's the majority? Are you seeing patients in the 20 to 30 range? And what's important to those age ranges? That's how you can really define the target in your practice for growth. And then you were able to then tailor those services to that specific demographic. Market research. This is very important. You want to be able to see, get that feedback from your patients. We've been talking about this. Are you looking at your online reviews and making improvements from those places? If you're let's talk about this from growing, right? You want new patients to come into your practice. If they're looking at your online presence and they're seeing 1 stars, they're still going to call you. But if they're also experiencing the same complaints, they're going to hang up and call someone else. So looking at all of those areas and making sure that you're improving on those experiences for your patients, for new patients coming in. And then looking at also your neighbors, the other doctors that are around you. What are they trying to accomplish? And you want to make sure that you're not overlapping too many efforts. I will say that there's plenty of patients to go around, but if we're talking growth, we want to make sure that it's something that makes you stand out, what makes you special. And you can really look at these areas and analyze these. Looking at your public data, there's health reports. You can analyze to look at the community health and what is most important to your patients. And making sure that you're monitoring industry trends. This is going to be, are you keeping up with the times? You know, do you offer things that people are looking for? Flexibility, telehealth. Do you look at online payment systems to make things more convenient for your patients? Um, these are all extremely important, and you can find these things through a number of ways. Again, like I mentioned, industry reports, there's journals. You can always rely on your association when you're looking at these things. So I'm going to stop right here for a minute, and I'm going to ask you guys about patient engagement. Do you think that patient engagement is important to growing your practice, and why? Why do you think that it's so important?
Yes. Hello.
Yes. Hi, Carissa. How are
Hi.
you?
Good, good. So yes, patient engagement is extremely important. It's important because our patients, they're patients. They're here for, to be treated. They're ill, they're not well, they're trying to seek cure, they're trying, they are not just visiting us, at the supermarket. And even if they were, we'd still want to give them a great engagement there as well, because we're providing a service. So we're providing a service, and we want to make sure that they feel important, that we're here to hear them, that we're here to help them as much as we can. Which goes to the slide before, where I was going to mention when it was your patients. I forgot, it was like on the second column. Not, and so really, if you're think it was like patient recognition or something it had said. And so
Mhm.
you want to make sure that you're recognizing and hearing what the patient needs, what they're experiencing, whether it's, positive or negative, and we can improve if it's a negative experience, but we need to know that feedback as well. But yes, patient engagement is very important.
Absolutely. Yeah, you're right. You're there, what are they telling you? You've got to be
Mhm.
listening to those things.
It starts at
Absolutely.
the front all the
Yes.
way to the, when that door opens, and whoever, it starts from there, and it trickles like a domino effect. Just, it goes on, it just continues until they are done with their visit, and, have left the office.
That's their journey, right? From the
Mhm.
time they try to find you to calling your office. And think about that. We're patients too, right?
Yes.
So
Yes.
when we call any company, whether it's a medical office or not, if they don't pick up the phone, we're going to hang up and call the next person.
Yes.
So you've
Mhm.
got to be looking at those things too. And it's not, people are aware that a medical practice is busy, but do you have another way for them to engage? Is there an online, portal where new patients can go to and ask questions about your practice? So those are things that are important. I just had a practice reach out to me recently. They saw that they were dropping a lot of phone calls. They did an analysis on their workflows, and they were dropping so many calls. Those are a lot of missed opportunities, you guys. So looking at all of those things, especially related to growth, very important. So to Carissa's point, yes, building relationships, extremely important. Strengthening those relationships through all kinds of ways, personalizing your emails, allowing for text messaging. Maybe it's Mrs. Smith, we're running about 15 minutes behind. So if you want to grab coffee, go right ahead. I know that sometimes that's unrealistic, but if you're trying to grow, you can implement some of those things to kind of help. Checking in on your patients to make sure they're feeling better. Maybe they were really, really sick. Someone should be calling them to check on them and make sure that they're okay, making sure that they're coming in for their follow-ups. And as Carissa mentioned, making sure that those channels for patients to give you feedback are being looked at. Enhancing the overall experience of the patient. Carissa mentioned that from journey one till the time that they leave, or from call one to the time they leave your practice. Super important in terms of growing your practice. I'm going to say one thing, and I'm sure you can all agree that the benefits of patient engagement are word of mouth. That's the cheapest, if you will, the easiest way to build your practice is if your patients are saying good things about you. So tell me, let's stop right there. I want you guys to, let's spin this into a positive note. Tell me something about your practice that your patients are going to brag about to their family, to their friends, to online. What are they bragging about? What makes your practice special?
that,
Maybe I,
oh,
oh, go
sorry.
ahead. No,
For,
please.
for us, what I've, realized, what I've noticed when I'm kind of, kind of just walking around or I'm in different departments is, they're pleased that when they call, that someone answers. It's not an auto attendant. It's not a whole recording and so forth. That it's a live person, which is my receptionist that I have in the front. And so they answer the calls live. They are always have a they have that voice that is pleasant, and regardless of what we're going through it, you will never know. It's just a hello, Miss Johnson, how are you? It's very pleasant, very welcoming. So they're always so happy that when they call that they're able to reach our receptionist. They talk to them. Our receptionist passes the message, gets right back to them within that day usually, or the MA does. So our response time with them, and how they're treated when they call, and that they're able to speak to us and not leave messages on all these recordings or all these inboxes. That's one thing that has helped us, or that we continue. And I have kind of waited out to see, should we go to an auto attendant? Should we not? Why? Again, because workflows change, and the phones do become overwhelming. But that is something that our patients look forward to, and it's been a benefit for us. So I haven't pushed to try to go to an auto attendant because of that. And we've just worked around it. So that's really something that has helped us as well, is really having that live person to interact with the patients.
That's wonderful. Yeah. I mean, that is, I appreciate that. And, sometimes like a lot of practices don't have that luxury, and we know that. But if they taught their patients that if you leave a voicemail, we care about you, we're checking them on a regular basis, we're
Yes.
gonna call you back, that's okay, right?
Yes. Mhm.
They trust you, you've built that trust with them. So I think, yeah, that's an excellent way. That's a great way that your practice or your patients can brag about you, is that someone's always picking up and that they know that they're going to be cared for. Anyone else have something that their patients would brag about? Maybe you do have a system that your patients love, and they can press one and they know they're going to get, Sandy on the phone or what have you. Anyone else have any, thing that their patients brag about before we move on from this slide? How about you,
Does
Wendy?
anybody, we do personal answering the phone too, but I'm teeter-tottering on getting the system where it's like press one for an appointment. And does anybody here have that type of system, or does everybody have somebody personally answering the phone?
Great question.
I've worked with both. Currently where I'm at right now, it's alive. But previously we had an auto attendant. Basically, you'd call, if you need to make an appointment, press one. If you need to leave a message for the providers, press two, and etc. It worked and it was fine. But what really became tedious, and having to kind of audit and make sure is that those messages were checked on time, that those messages were, that we were doing our due diligence, and that your staff was doing the due diligence to check those voicemails and not leave them there or just remove them. So there is a little bit more time consuming in monitoring those calls to make sure they're all being answered, reviewed. So as long as you have that in place, I feel that it will work and it's fine. And then you just kind of educate your patients that when you call, you are going to hear an automated service, but it is going to a person who will be reaching out to you. That was my experience, is that we just kind of had to make sure that we were checking them more frequently.
Okay, yeah, because our thing is our phones go off at 8, and I have 2 receptionists, and then we have our back office staff, and I have remote staff, but like everybody will pick up the phone because there's like 30 calls coming in at 8 o'clock. And so we're accidentally double booking our provider, because while the person that's remote picked up the phone, the person that's in office they're making appointments at the same exact time. And I don't know how to go around that at this point, like besides doing automated. And I'm a little afraid of automated.
That does sound like a challenge, Wendy, because yeah, you're overlapping energies, and then you're having to call patients back. I think you sit down as a team and say, how do we handle these call volumes? Or maybe you have, maybe Carissa can also add, or anyone else on the call. But maybe you have, all hands on deck during that time, and each person is handling a different section of the schedule. I'm not sure, but to
That is a good idea.
Yeah, but to Carissa's point, I agree. I think that as long as the messaging system works. I had one doctor and just me, and I had a line that they would press 1, 2, or 3. How we used it was press 1 if you want to speak to a member of the office staff. press 2 to schedule an appointment, and then it routed them somewhere else. At the time we had a scheduling system online. And then third was just to hear more information about the practice. So there's ways that you can segment those where you're able to kind of route some to those people that are just wanting some information versus all the scheduling. So just think about that if you are adding those in. So let's go. I want to get through some of these. We have some time, and you guys are doing great. I really appreciate the engagement. So let's talk a little bit about marketing. You know, you're growing your practice. You want to start the planning phase. We're going to start from planning and go through to management. So you want to have a marketing plan that outlines your goals, who's your target audience, those strategies in place, making sure that you're managing that in some capacity, whether you're looking at different activities or you're using a tracking tool. You want to make sure that you're managing your strategy. Offline integration, what this means is making sure that everyone's on board with this strategy. If you have made some revenue enhancements to your practice, maybe you're marketing a product, you want to make sure that everyone in your practice knows about that product so that when people are calling, there's cohesiveness. Traffic building. This is going to be essentially, you know, if you are defining one special thing about your practice that you're driving traffic to your site, how are they finding you? They're not just going to knock on your door and say, hey, what do you do? How are they finding you? Some practices, it's a little trickier to have social media in a medical practice, but it can be done, especially if you're looking at a particular resource. So we were sports medicine, and we were trying to focus our efforts on resolving everyone's knee pain in Orange County, you know, everyone. And so we put out a series of Instagram posts. We recorded them all over a week's time. And we started to talk about some ways that you can stretch and just different things. That built a lot of engagement. So there are ways to do that. Optimization process. This is essentially, you know, making sure that you're looking at all of those strategies, you're getting feedback, you're testing your marketing theories. Conversion analysis. This is making sure that your efforts are leading to patient and not just putting more work on your practice. You want to make sure that those efforts are fruitful. I saved the best for last, website design. Nobody's going to find you unless you're online. That's how majority of people are trying to find people these days. And so having a good website that's easy to navigate, mobile friendly, because we're all sitting here at night looking at our phones when we have the time. So are you able to click on things, you know, on the website? So let's pause here for a moment and talk about some of these things. What marketing, do you have a website? I'm curious. And do you feel it, if you don't have a website, what was the reason for that choice? Just curious, talking about these marketing strategies.
We do have a website. It is under construction right now again.
Good. That's fine.
Yeah, we do have a website.
Good. So that's great. I mean, under construction, I think I'm going to say, and maybe people don't agree with me, I think your website should always be under construction. It should always be making improvements. Maybe you're putting out blogs or, you know, some things for your patients to provide that feedback. There's always improvements that can be made to your website. And by the way, I mean, I'm not an expert in this field, but I'm pretty sure that when you're making those adjustments, that you're staying fresh in the market. You're not getting buried. So it could just be a very easy way to keep those SEO activities elevated. Anyone else have
website and social media? We have Instagram, and we're constantly posting on Instagram, you know, oh, it's summer, make sure your kids wear SPF, whatever, or, you know, Easter time, like the candy, or, you know, just whatever the season is, we're constantly posting about things to do for your children, or like summer, do these activities with them.
That's awesome. And then I'm curious, when did you get feedback from your patients? Do they like that?
Yeah.
Good. Yeah. Then you guys are doing things right there. Fantastic. And, you know, since you're building a social media presence, when the time comes and you start to say, let's focus our efforts on childhood vaccinations or whatever. Then you can start to use those pieces to enhance those efforts. All right, let's move on to the next one. So we know this is something we talk about all the time. I'm just going to throw these up here because these are separate trainings we have on a regular basis, but these things are going to either help or hurt your growth. Making sure that you have those workflows optimized, having some automation tools, allowing your patients to schedule online. It's not necessary in Chris's case. She's got someone that's physically answering doing those. Fine. So does Wendy. But are there ways that you can enhance those efforts for growth? Absolutely. And some of these things are, patient scheduling. If they can't ever get in, maybe growth needs another clinician. Maybe you need to hire a part-time MP to kind of support your practice. That's going to help you grow. I will stop at the financial management because I think one of the biggest things is physicians, practice managers they want to grow their practice. The reason is usually financial. And, and Dr. Bittman trains in our comprehensive practice optimization, and we train through our workshops that it's not always the answer. New patient, adding more patients, it's really making sure that you're maximizing all of those patients. You're getting the full reimbursement that you deserve for all of those patients. And so financial management is a huge factor in growing your practice. Plus, if you're trying to grow, you're going to want to add staff. You're going to maybe want to consider enhancements to your practice that are going to need some financial support. So kind of looking at that revenue cycle and where can we pull from, or what can we work to improve so that we can grow. So the most important part of growth, in my personal opinion, growth takes, anyone want to guess? Time. You have to be patient. Remember that growth is a journey and it requires persistence. It requires, time, dedication, and it can sometimes take more time than you think, especially when practices are starting from scratch. I can share that I've had practices call and say, how do I get more patients? And I wish that I had a magic wand and had an influx of patients that I could send them. But the truth of the matter is that it does take time. It takes care. It takes building the know, like, and trust factors within your practice. And you do need to be patient. Now, we can support you with ideas. We can support you with resources. There are certainly companies that can take you from point A to point B, but just be patient. Growth does take time. And then finally, I'm going to send you out with a little bonus content for today, something to take away, when you get those, we need to grow, responses from clinicians, from your practice owners. Pull this out. Consider doing a SWOT analysis. And what that is really, okay, let's talk about our strengths. Let's talk about what our weaknesses are and what we're going to need. What infrastructure do we need in place to support this idea, to support this growth? What opportunities are out there? What's in the community? What are, do we have, do we answer our phones on every ring, and can we maximize those things for growth? And then of course you need to consider your threats. What are the external challenges? What is the competition? What are some of your regulatory changes that you need to consider when growing?